Imagine waking up one morning to discover that the health benefits you have relied on for years, your doctor visits, your prescription coverage, even your access to hospitals, are about to change. For millions of American seniors, that is not just a hypothetical. With the enactment of the Beautiful Bill, a sweeping set of reforms reshaping Medicare, these changes are becoming real and immediate. Healthcare for seniors is one of the most sensitive and vital issues in U.S. policy. Medicare, the federal program serving over 65 million older adults and people with disabilities, has long been a lifeline. Campaign after campaign has promised to protect seniors and fix the system, but turning promises into actual policy often produces unexpected outcomes. The Beautiful Bill is a prime example. It is promoted as a bold reform to improve affordability, reduce government waste, and ensure sustainability, yet its provisions are already altering how seniors experience their healthcare. This piece explores what the Beautiful Bill is, how it changes Medicare, and what those changes mean for older Americans, examining key shifts, weighing the benefits and drawbacks, and closing with practical advice for seniors navigating this new landscape. The Beautiful Bill, officially titled the One Big Beautiful Bill Act, is a broad package of healthcare and budget reforms. While marketed as a measure to streamline and modernize Medicare, its real-world effects cluster into several key areas. The bill strengthens the government's power to negotiate prices for a wider list of prescription drugs under Medicare Part D, imposes new price caps tied to international benchmarks, and aims to reduce the out-of-pocket burden for seniors. However, some pharmaceutical companies have warned of reduced innovation and narrower formularies. Certain categories of legal residents who previously qualified for Medicare coverage may now face stricter requirements, a shift intended to cut costs, but which could leave some older immigrants without coverage during a vulnerable stage of life. The Beautiful Bill also loosens marketing restrictions and oversight for private insurers running Medicare Advantage plans. While insurers may gain flexibility to offer new supplemental benefits, critics argue it could lead to aggressive marketing or reduced consumer protections. In addition, Part D standalone drug plans receive less enhanced support, which could translate to higher premiums or fewer plan choices for seniors who do not use Medicare Advantage. During the campaign and legislative debates, proponents of the Beautiful Bill promised seniors lower drug costs, more choice, and beautiful savings to taxpayers. Advertisements highlighted the plan's no cuts to essential benefits pledge and a vision of a more transparent, efficient Medicare system. Key promises included significant relief from high prescription drug prices, expanded preventive care options, and a stronger safety net to ensure Medicare's solvency for future generations. At first glance, these promises were compelling. For seniors struggling with rising health costs, any pledge to reduce expenses seemed like good news. Now that the Beautiful Bill is in effect, early data and anecdotal reports reveal a more complex picture. Many seniors are indeed seeing some reduction in the price of a few high-cost medications, but others are facing restricted formularies and higher copays for drugs not covered under the new negotiation rules. The tightening of eligibility requirements has already resulted in coverage gaps for certain immigrant seniors. Advocacy groups warn this could lead to delays in preventive care and increased use of emergency rooms. While more Medicare Advantage plans are entering some markets, the loosened oversight means seniors must be more vigilant about plan quality, provider networks, and hidden costs. Changes to plan structures and formularies also mean more paperwork, more comparison shopping, and a steeper learning curve for beneficiaries. Every major reform creates winners and losers. Under the Beautiful Bill, potential winners include seniors who take expensive brand-name drugs included in the negotiation list, private insurers gaining flexibility to design new benefits packages, and federal budget planners looking to slow spending growth. Potential losers include seniors who rely on drugs outside the negotiation list or who need broad formularies, immigrant seniors facing stricter eligibility criteria, and beneficiaries in rural or underserved areas if insurers narrow networks to cut costs. Seniors and caregivers can take proactive steps to adapt. Reviewing your plan annually is crucial. With subsidies changing and formularies shifting, it is essential to compare your current plan to alternatives every year. Using official resources like Medicare.gov and state health insurance assistance programs can provide free counseling to help beneficiaries choose wisely. Checking provider networks, especially for Medicare Advantage plans, helps ensure your doctors and hospitals remain in-network. Do not accept the first no when a service or drug is denied. The appeals process can reverse coverage denials or cost increases. Staying informed by following credible news outlets, advocacy groups, and nonpartisan think tanks helps track ongoing regulatory changes. The beautiful bill also illustrates the broader tension in U.S. health policy, balancing fiscal sustainability with universal access and quality care. Policymakers want to slow Medicare's cost growth, but seniors expect stability and affordability. The result is a push-pull dynamic where reforms are often praised for saving money but criticized for eroding benefits. In many ways, the beautiful bill's real impact is a reminder that campaign promises rarely translate perfectly into legislation. Seniors' health care is deeply personal, and even small changes in coverage can have outsized consequences. When we opened, we imagined waking up to find your health benefits had shifted overnight. For many seniors, that is no longer a hypothetical. It is their reality under the beautiful bill. While some aspects of Medicare have become more affordable, others have become more complex or restrictive. The bottom line is that promises of beautiful reforms sound appealing, but the real test is whether those reforms truly protect and improve the lives of the people they are meant to serve.
As the beautiful bill continues to roll out, seniors, caregivers, and advocates must stay vigilant, informed, and engaged to ensure that Medicare remains not only financially sustainable, but also humane, accessible, and equitable.